I was diagnosed with type 1 diabetes at the age of 25.
I was diagnosed at the age of 4.
I'm 26 right now. I got diagnosed at 24.
It was my first pregnancy, and I had been diabetic for about 31 years at that point, type 1.
We went to the doctor, and then they tested me, and when they came back, they said I had diabetes. I get insulin.
Diabetes is a life-changing event.
It felt like no matter what I did, I couldn't keep up with it.
Until you are faced with this diagnosis, I think people do not realize how involved it is and how that all comes into play when you're managing your children.
To kind of counteract that, you need a support team that's going to help make things back to normal.
Mary and Dick Allen Diabetes Center was created essentially to be a resource for the community.
Diabetes is an expensive disease, it's a complicated disease, it's a disease of the whole family, and we stop to think about the fact that there are a lot of people here in Orange County, for sure, a lot of people who border Newport Beach, who don't have access to the kind of care that our granddaughter was fortunate enough to have. And so Mary and I thought we need to help do something about that and give people access to diabetes care, irrespective of their ability to pay for it.
Here at the Mary and Dick Allen Diabetes Center, we provide comprehensive care for people with both type 1 and type 2 diabetes, offer them the latest technology and the newest medications that help them to achieve both freedom to do what they want to do when they want to do it, and control of their blood sugars as well.
We're particularly proud of a number of the programs that we have that I think make us a bit unique. They're programs that we wanted to put in place. They are in place, and they provide really specialized care.
Can I see your insulin pump? Yeah.
CHOC Children's Hospital, which is the leading premier children's hospital in Orange County, has an established office here functioning fully to support all the children with diabetes in our area.
Our diabetic educator, Liz, introduced us to the pump and the Dexcom when we were at clinic.
Here at this center, I am the nurse here. So they don't see any other nurses, they see me. And so the consistency and the management, I get to know these kids really well.
Their support has been amazing. I don't know how I would do it without them. Anytime I have a question, they're there and very supportive.
I tell my families that they're going to grow with us here.
We recognize the difficulty in transition from being a pediatric patient to being an adult patient. Oftentimes it's a difficult time of transition where people may be moving out of the house, going to college, money may become tight, insurance issues also arise as well. We do have the Herbert Family Program here, which helps those patients with young adults who have type 1 diabetes transition from the pediatric care to adult care.
There's even more questions that arise when you turn 18 or when you go off to college that when you were before 18 you didn't really have to worry about. And the Herbert program has enabled me to not only grow as a person, but grow as a person who I just happen to have a chronic illness, not a person with a chronic illness who happens to be in his 20s. So without the Herbert program, I would probably be very unhealthy because I would not know the proper way, and I would not be as astute and studious with maintaining my blood sugar and maintaining my health.
The Sweet Success program is a program for any woman who's considering pregnancy or is pregnant, who has diabetes or is at risk for developing gestational diabetes.
I had gone to my OBGYN, had never heard of the center, didn't know it even existed, knew I had to have a perinatologist. She referred me here, and the way it was presented, I thought it was just going to be what I already knew. How to do carb counting, and I thought, well, what does a type 1 diabetic need that for? And then I came here, wow. All kinds of information that I didn't know, and also support that I hadn't had before. I really wanted to have 2 successful pregnancies, and I was able to with the help of the Mary and Dick Allen Diabetes Center.
Here at the center, I definitely have had a life-changing experience. And with all the tools I have, from the great technologies they offer to the support to making me feel at home and not let diabetes take over your life.
The combination of technology, the combination of newer medications, the combination of a healthy diet along with exercise, this holistic approach, I think, is just so powerful.
The center has done a lot of good things already, but I think the truth is we're not done. There's a lot more to do, and we're committed to doing it.